Hi, I'm Dr. Sharbell Hashoul, and today let's talk about something many people don't realize is linked to breast cancer risk: alcohol. If you've ever wondered whether that glass of wine at dinner really matters, you're not alone. This is one of the most well-studied lifestyle factors in breast cancer research, and the evidence is actually quite consistent. Here's what we know. Multiple large studies, following hundreds of thousands of women over many years, show that alcohol consumption is linked to a higher risk of breast cancer. And importantly, this isn't just about heavy drinking. Even light to moderate drinking, think one drink a day, has been associated with a modest increase in risk compared to not drinking at all. The risk appears to increase with the amount of alcohol consumed. So someone who has 2 or 3 drinks a day has a higher relative risk than someone who has less than 1 drink a day. This is often called a dose-response relationship, meaning more alcohol tends to mean more risk, though the relationship isn't perfectly straight line for everyone. So how does alcohol actually affect breast tissue? There are a few theories that researchers take seriously. One is that alcohol can raise estrogen levels in the body, and estrogen is a hormone that can fuel the growth of many breast cancers. Another is that when your body breaks down alcohol, it produces a substance called acetaldehyde, which can damage DNA. There's also some evidence that alcohol may make it harder for the body to absorb certain nutrients, like folate, that help protect cells from damage. Now, it's important to put this in context. Breast cancer risk is influenced by many factors working together, not just one. Things like age, family history, genetics, reproductive history, body weight, physical activity, and yes, alcohol all play a role. No single factor determines whether someone will or won't develop breast cancer. Alcohol is one piece of a much larger picture, and for most people it's a modifiable piece, meaning it's something you actually have some control over. It's also worth saying clearly this isn't about fear or guilt. Plenty of people enjoy a drink socially, and an occasional glass of wine isn't going to be the deciding factor in anyone's health story. This is about understanding a real measurable risk factor so you can make informed choices that feel right for your own life and values. Major health organizations, including the American Cancer Society and the World Health Organization, generally advise that if you drink alcohol, doing so in moderation or reducing intake can help lower breast cancer risk over time. For women, moderate drinking is often defined as up to 1 drink per day, though guidance can vary, and less is generally considered better when it comes to cancer risk specifically. Here's a practical takeaway. You don't need to overhaul your entire lifestyle overnight. If you drink regularly, it's worth having an honest look at how much and how often, and considering whether cutting back feels manageable for you, pairing that with other protective habits, staying physically active, maintaining a healthy weight, and getting regular screening based on your doctor's recommendations can all work together to support your overall breast health. And remember, this information is general. Your own personal risk depends on your unique health history, family background, and other factors, so it's always worth having a conversation with your doctor about what makes sense specifically for you. Thanks for spending this time learning with me today. Taking small, informed steps is one of the best things you can do for your long-term health.